Malaria is spread by female Anopheles mosquito. These mosquitoes thrive in waterlogged areas or bushes. When it rains, the floods create a breeding ground for mosquitoes. The Health Ministry says 30 out of 100 patients are suffering from malaria. According to the ministry, statistics show that Karamoja, West Nile and Busoga sub-regions have the highest positivity cases. Other regions are said to be below 10% prevalence. Today, the Ministry of Health, the Kyabazinga of Busoga and Biosensor represented by Josu launched a campaign against malaria. The Minister of Health, Dr. Ruth Acheng, said that as government rolls out the parish development model, there is a need to fight malaria in order to have a productive population.
The expenditure that goes towards the medicines for malaria is $18.5 million annually. And towards the rapid diagnostic tests is $8 million annually. This expenditure is huge and it impacts greatly on other programs. And yet malaria is preventable.
Josu, which represents the manufacturer of the test kits, Biosensor, has donated 100,000 malaria test kits.
And if every Uganda is eligible to 3 or 4 attacks of malaria, that means we don't have adequate test kits.
The ministry says there is a plan to start manufacturing the kits in Uganda.
When we produce from here, it is going to reduce by 30% of the current cost because now there is importation, there are logistical problems. Also, it is going to employ the Ugandans that benefit here.
Although government has fought malaria prevalence from 42% in 2001 to 9% now, the Health Ministry Permanent Secretary, Dr. Diana Twine, says a lot more can be done.
Your Majesty, we have had challenges of climate change. We had brought down malaria significantly, and we thought by now would have brought this malaria further down. The prevalence of 9% is still a huge one. Actually, it keeps on oscillating based on the season.
This is the message from the Kyabazinga, who is championing the anti-malaria campaign, which he wants to be rolled out across the country.
I would like to inform you that the most affected regions do not have blood banks or adequate supply, and my prayer is that the ministry considers to urgently establish a blood bank in Busoga and other affected regions to be able to save lives.
The health experts say that one of the major reasons as to why children die from malaria is the fact that there is delay to be taken to hospital for treatment. And malaria normally attacks the red blood cells and thus normally causes anemia amongst the children before they die. The Ministry of Health says they are going to be rolling out the malaria vaccination in 2023, but it can only be 50% effective. That means the country or everybody must focus on the prevention and also management of the disease. Sudil Biaruhanga, NTV.